Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, so it's Heart Health Month. It was also Valentine's Day. Why don't you take the topic of love, combine it with Heart Health Month, and share as much about having a healthy heart with the ones that you love. Your heart is the organ in your body that works the most. So why not celebrate it the most? And why not have as much information about it and how to keep it healthy and pass it on to the ones that you love? So look at your mom and dad and say, hey, mom and dad, did you know that too much sugar can affect your heart? Did you know that smoking is horrible for your heart? Happy Valentine's Day. I love you. Joining us from Adventist Health is Dr. Huang, who specializes in cardiovascular electrophysiology. Doctor, how are you?
I'm good. How are you?
Good, thank you. How did you like the intro about, instead of buying a card, just talk about how to keep your heart healthy for Valentine's Day?
I think that is the best gift that one can give. Yeah.
Heart health.
Yeah.
So what got you into the practice of studying the heart? And as you were saying earlier, heart palpitations, heartbeats.
Sure. Yeah. I really enjoyed engineering in college, actually, and the physics and how things work. And when I went to medical school, it was a natural intersection of the two. I can try and fix the pump and help people feel better. What better way to make a career?
No, but I love that. I love that you took your passion of engineering and then applied it to the body. Because we're pretty much like we're buildings.
Yeah,
in some level.
In some ways, yeah.
What is the one thing about the heart that would surprise us the most that you think that we may not know?
That's an interesting question.
Because as I was saying earlier, it beats 60 to 100 beats per minute.
Yeah.
If you're super active, 40 beats at resting heart pace.
I think a lot of people don't realize that the heart is a pump, but the pump is actually controlled by electrical waves that tell the heart how fast to go. Much like a drummer in the front of a marching band sets the tone, and the rest of the marching band, the heart, will actually follow to that beat. And that's kind of what a normal electrical beat of the heart looks like.
Okay, I love that.
Yeah.
What is some of your medical history, doctor?
What do you mean by that?
What I mean by that is when we come back after the break, we're going to find out where you went to school,
Okay.
Where you studied engineering, and we're going to dive into the signs and symptoms of palpitations that are off, what that means. We're going to share with you what an anxiety attack is, because a lot of people think when they're suffering from an anxiety attack, it could possibly be a heart attack, and how to keep your heart healthy. Now, get up, tell the ones you love them, and go get a carrot stick, a celery stick, glass of water, and pass on happy heart health tidbits, and we'll see you on the other side. Don't go away. Welcome back to Healthline. I am Gregory Zarian. So did you have carrot stick, celery? Did you have a glass of water? And did you tell the ones you love them? Once again, our mission here at Healthline is to give you as much information as you can about you and your heart and your health and living a healthy lifestyle. Because the best gift you can give somebody is information that could possibly change their life, save their life, and enhance their life. So give the gift of information about your health. Joining us from Adventist Health is Dr. Huang, cardiologist, and your specialty is cardiovascular electrophysiology. Doctor, before the break, I addressed what is some of your medical background?
Sure, yeah. So I studied engineering at Berkeley, bioengineering to be exact, and then went to medical school at UCLA, and then did my internal medicine, cardiology, and cardiac electrophysiology training all at UCLA. So.
And now you're at Adventist.
And now I'm at Adventist Health, and I work with Glendale Heart Institute. It's a group of cardiologists. Dr. Aliman, Dr. Dallinger,
Sure.
Dr. Rafi, and Dr. Solpour are all my partners.
When we think of the heart, and as you said earlier, it's the hardest working muscle in our body. Even when we sleep, it works. And we think of palpitations or irregular heartbeats. What is a palpitation, and is it the same as a heartbeat?
Sure. So most people can feel their heartbeats when they're anxious or they're exercising. You kind of feel like your chest is pounding, and those are all normal.
It's a rush of endorphins. It's this.
Yeah, and the heart's pounding. It's actually working really hard. The brain and the heart are working together.
And for those of you at home, did you hear what the doctor said? Working out. We're the most obese country in the world. Get up, get out, and work out, and feel that beautiful heartbeat, and sweat a lot. Okay.
Yeah,
doctor.
No, that's true. I think that's probably going to save more people overall, just to exercise. And we know that if you can exercise for a good amount of time, people
minimum 150 minutes a week.
And people live longer the more they can exercise. That's generally proven to be true. So I think that's definitely a very good statement.
And also what it is too is one thing, I'm sorry for interrupting, is we as a country have spent so much time on the iPad, on the phone, and gaming that we forgot what it's like to interact. So instead of going outside with your friends and being on your phones, go outside and go for a hike, go for a walk. If you've put on weight from the holidays or just because, change your habit. It's up to 3 weeks you change a habit. Walk a little bit more, climb some stairs, baby steps to change what you're doing, and instead of complaining about the weight, celebrate about the weight that you're letting go of.
Yeah.
True?
I totally agree. I think there's plenty of studies that say sedentary lifestyle is you're going to do worse off.
And it just doesn't happen. We do it. Okay, doctor, I'm sorry. So when we work out, our heart beats.
So those are normal palpitations. And so those are the brain telling the heart to pound a little bit harder because you need it. Whether you're emotional, you're exercising, you're just trying to get a little bit more energy to match the situation of the circumstance. What I specialize in is beyond the normal. And so people have palpitations that may represent irregular heartbeats. Much like that drummer and the marching band thing we were talking about earlier.
Yes.
What if you have a renegade drummer and they hit the beat and then it beats out the regular drummer? Now the marching band's listening to a different heartbeat and beats to that rhythm. And some are benign and they only last a second or a beat at a time. Some people kind of talk about them like a hiccup of the heart. And those are benign overall.
So when you say benign, meaning it could happen. So I'm very healthy. Could I have a benign heartbeat? Like could my rogue renegade drummer be and beat all of a sudden and then come back?
Yeah, so about 10% of people actually have these irregular heartbeats. And some feel them, some don't. We generally in medical school consider them to be benign and not dangerous. What we realize is that if actually people have a lot of them, about a quarter of their heartbeats overall, are all the irregular heartbeats, that can actually weaken the heart muscle, and a cardiologist should evaluate those.
So what happens though? What is it? Because if it's such a, and I love your analogy of engineer, you're now an engineer of the heart. Beat, bum bum, bum bum, bum bum. Why does it go rogue for a beat here and there? Does it just happen? Does the electrical make it misfire a little bit? Is that what is that?
Yeah, so it's interesting. You can actually take cells and grow them on a dish, and very smart people, probably smarter than me, can learn how to actually make little cells beat on a dish.
Really?
Yes.
Wow.
And so I think that really gives us insight that a lot of the cells in the heart can be pacemakers.
Okay.
Just like a regular one that we're born with is the drummer. They can have other drummers inside the heart. And some of them are a little bit more active than others, and some of them get activated when people are super anxious or exercising beyond the normal.
Is it common for everybody to have a rogue drummer here and there?
Yeah, 10% of people have them.
And do we know it's happening or not always?
Not always.
And last question before we go to break. Just say I experience the rogue drummer over here maybe once or twice and then it goes away. Do I need to call my heart doctor?
I think generally by itself, no.
Okay.
If they bother you, yes. And then the other reason to call a cardiologist or a doctor about palpitations that are beyond the normal is if they're happening all the time. Certainly if you have chest pain or trouble breathing or dizziness, those are dangerous signs. That could be something very serious. and the palpitations are just coming on for the ride.
Perfect, thank you. Okay, more with Dr. Huang when we come back. Don't go away. Welcome back to Healthline. Did you know that Adventist Health Glendale has been recognized by U.S. News and World Report as one of the best hospitals for 2018-2019, ranking 15 out of 133 hospitals right here in the Los Angeles area and 28 out of 414 hospitals here in California. And joining us from the Glendale Heart Institute is Dr. William Huang. Doctor, what we do now is we post questions on social media and we talk about the topic. And we put out there that you were going to be with us, and a viewer, a Jay Kinnear, asked this question in regards to heart palpitations. What kind of palpitation do you as a cardiac electrophysiologist find concerning?
So that's a really good question. So we did talk about the renegade single drummers, kind of hiccups of the heart. But let's talk about a different category of palpitations that could be concerning to me.
So then there are a few categories then, so
Absolutely.
It's not, okay.
Yeah,
Please tell us what we have to look for.
So sometimes these renegade drummers don't only just beat one every few beats, they drum at their own rhythm and take over the entire heart rhythm. And sometimes these things are really fast.
So they pretty much override.
They override the whole system.
So you have the ba-bum, ba-bum, and then you have somebody in the background, or does it actually go to the forefront? Makes me think of that little monkey or the Energizer bunny. Okay, so they actually go, so they override the
So sometimes these
heartbeat.
things can go 200 beats per minute, and that's really fast.
As per the 60 to 100.
Yeah, 60 to 100 generally is a good ballpark range of normal
Okay.
resting heart rates. Yeah, so 160, 180 could be, a good exercise heart rate for some people, but 200 is well beyond the normal.
So then you feel that in your chest. Then what is that?
Yeah, so there's a category of, I'll get a little technical with you.
Please, no,
yeah,
please.
so there's a very common one that comes up in younger people called supraventricular tachycardia.
Younger meaning what are ages?
Like 20s.
Okay.
Yeah.
Male and female?
Yep.
Okay.
And sometimes their heart will race, and just by happenstance, they'll actually figure out that coughing or drinking a big glass of water or bearing down real hard can actually stop it.
Really?
Yeah.
Okay.
And so they'll come to my office and say, yeah, I can stop it, but it's really bothersome.
But somebody stopping it, that's not an antidote to not call your heart doctor.
That's correct.
Okay.
Yeah. No, it definitely doesn't substitute a doctor's visit.
But also the same thing about Googling online. People think, oh, Google 5 entries down said blah, blah, blah. Which it's great, because sometimes Google and the internet can really help you,
Yeah.
but you never want to take something like this into your own hands.
No, that's true. And what I tell patients, actually, I give them sources to trust.
Okay.
And so at least for the heart, American Heart Association is a really good one. That's for general heart health.
Okay.
And then what I specialize in is heart rhythm.
Okay.
And so Heart Rhythm Society is actually a really good source for any viewer out there to read more about these kind of electrical anomalies.
Great. So let's go back to what you're saying. So it
Yeah.
happens to boys and girls in their 20s.
Mm-hmm.
What is the name of the condition?
Supraventricular tachycardia.
Okay.
And it could happen at any age, but it seems to come up in younger populations, at least from an adult cardiology standpoint.
So then how do you treat that, and does it just happen? Is it just,
Right.
why does it happen?
Yeah, so actually it turns out that a lot of people are actually born with abnormal electrical connections in their heart. And so what we talk about is a nice little wave that electricity flows through the heart. That's usually like a rock in the pond.
Okay.
And the ripple will just flow right through. But it gets a little bit more complicated than that. It turns out that sometimes it can go back in on itself
Okay.
and short circuit the system. And then so now it's going around on a train track, so to speak, and it just goes around and takes on a life of its own.
Back to the rogue drummer, but this is now a train.
Now it's
So then how do you treat it then?
Yeah, so medicines usually can help a lot of people and just kind of suppress it. Sometimes it comes back though.
Can you grow out of it?
Sometimes,
Okay.
and usually not.
Okay.
Yeah, and one of the procedures that I specialize in as a cardiac electrophysiologist is actually to get in the heart and study it. Most patients ask me, like, so what does that really mean?
What? Oh, please pick me. What does that mean?
And I'll throw in another analogy. I like analogies. But essentially, we're taking electrical equipment to place into the heart using
Okay.
just the veins. So it's not open heart surgery. It's minimally invasive. And essentially we get into the heart and electrically tickle the heart and see if it giggles. And that's what we do. And that's an electrophysiology study. And then once as we get it giggling, then we can study it. Where is it giggling from, and where can we?
But then so then you also find out where there's a short circuit in the giggle.
Exactly.
Wow.
And then we can actually deliver energy called radio frequency, but it's essentially a heating tool.
Sure.
A very controlled one, and then we can destroy that little circuit so that the train track is now cut in half. And now they don't have to live with that ever again.
So, okay. Is it permanent? Is it a permanent solution then?
Yeah. It's very hard to say cure in the world of cardiology, but
So
this is
how'd
one
you
of the
like
fear
that?
things.
Solution.
Yeah.
Wow.
Yeah.
So then it is an actual factual cure that
Yeah.
you can actually fry the nerve
Yeah, electrical
take-
connection, yeah.
or destroy the
Yeah,
destroy the train track.
The train track, yeah. Cut it in half so the train can't go around in a circle anymore.
Is there a recovery for this procedure?
Yeah, generally they come in the morning and go home at night.
Would a patient feel that they were tickled in their heart and that something has changed?
That would be, we tickle the heart under sedation. So,
Okay.
I think for analogy's sake, for people to understand what we do, that's a good one. But no, generally they're asleep during that procedure.
And then afterwards, is there a recovery? Do they have to just take it easy for a while?
Yeah, usually take it easy, don't lift anything heavy just because we access the veins of the leg.
Okay.
And we don't want it to bleed. And so we say, generally don't pick up anything more than 10 pounds for about a week. Walking is fine, going up the stairs is fine, but overall, move on with your life.
And it's time to pick up a new set of drumsticks and get on a different train track.
Yeah, go exercise.
More with Dr. Huang when we come back, and we're also going to share with you the signs and symptoms of a heart attack, anxiety attack, and how to keep your heart healthy. Don't go away. Welcome back to Healthline. I am Gregory Zarian, and the entire conversation has been about you and your heart. Joining us from the Heart Institute at Glendale Adventist is Dr. William Huang. Doctor, I love the analogies about your heart. There's a tickle, the drum or the train, because it kind of breaks it down. One of my missions on this show is to break it down for a 5-year-old so we can just see it and understand it instead of all these big words that don't make any sense. Could a because we hear the word pacemaker often. Oh, so-and-so got a pacemaker and this, and helping the heart get its beat back. Could this, what you talked about, be treated by a pacemaker as well?
Yeah, I think that comes up a lot with my patients as well.
And what was the name of the?
The supraventricular tachycardia. Yeah, that's one set of heart rhythm issues that is quite common that most people don't know about and can be treated very effectively with procedures.
What are other sets of heart conditions?
Yeah, so the most common rhythm is atrial fibrillation.
Okay.
And that comes with older age. And that's the biggest risk factor. And that's an irregular 500 times a minute in the upper chamber rhythm. It makes the whole thing quiver.
Okay.
And sometimes we need medicines to slow that down.
Okay.
So people don't have the palpitations associated with that rhythm. But as we get older, sometimes the electrical system gets slower and it can't handle the medicines. Yeah.
Sure.
So you're trying to find a sweet spot, not too fast, but not too slow. And sometimes people have both.
Okay.
And so in that situation, a pacemaker can be very helpful because you need the medicines to stop the fast rhythms, put the brakes on the system.
Okay.
And then you have electrical backup with a pacemaker so that you never have to worry about a slow heartbeat that can make you faint, pass out, and hurt yourself.
And a pacemaker is just to get you back on track, so to speak.
Yeah, yeah. You don't, if it's too slow, you need something.
Okay. Can diet and exercise, can diet and exercise help your heartbeat come back? Can it, without medicine, just say some people don't want to do medicine or any of like the pacemaker or treatments, can upping your workout, eating healthier, can that change any of what we're talking about?
Yeah, so actually the most common rhythm, atrial fibrillation, is very modifiable with lifestyle changes.
Okay.
And that has up until now been associated but never proven. And there's some recent studies showing that if you actually lose weight, exercise, that actually reduces this rhythm burden, this atrial fibrillation where it's beating on the heart and trying to make it go fast. So I think 100% there's definitely modifiable lifestyle things.
Talk to us about how to keep our heart healthy, and then I want to ask signs and symptoms really quick about a heart attack and anxiety. So how do we keep our heart healthy, doctor?
It's good. That's good. I think it's preventative cardiology, and I think this is underemphasized.
Because some stuff is hereditary.
Right.
So you have to ask your mom and dad and grandparents and anybody in your family what's up with the heart.
Yeah.
And then you'll get the family history.
Exactly. And then there's diet, exercise. I think those are the two main things that are easy to prescribe but hard to follow.
In a laser round, what's a healthy diet for heart health?
Sure. So generally speaking, high in vegetable content.
Okay.
And it's really interesting because vegetable content seems to reduce hypertension, which is a really big, cardiovascular issue. And that increases stroke, heart attacks, other things like that. So if you can modify that with just eating more vegetables, and particularly green leafy vegetables, that seems to do a huge help.
Have a colorful plate.
Yeah, I think so. I think a balanced diet, reducing the fat, reducing the salt, and that generally helps from the diet perspective.
Minimal alcohol, cut out the cigarettes.
Yeah, smoking is a big thing.
Smoking can kill, period.
It's interesting. In medical school, one of the things I took away from the lectures is actually if you can stop people from smoking, you'll help them live longer than if you prevent their heart attack, prevent this and that. Amazing. Yeah,
I smoked for 20 years, 2 packs a day. I quit over 13 years ago.
Yeah.
Best choice I ever did.
So I stopped smoking. Excessive alcohol seems to be a big issue for some people as well. There's some data suggests that 1 glass of red wine can be beneficial, but that data's neither here nor there.
But it says 1 glass.
Yeah, and it's specifically red wine from near the ocean in France, right? I mean, who knows how much. So how much of this is transferable to other alcohols is totally
And as far as
unclear.
activity, we've already addressed movement, getting up, moving, elevating your heart.
Absolutely.
Right.
Yeah, I think generally getting your heart rate up and keeping it there for at least 15 minutes at a time, I think that generally will be a good cardiovascular workout so that you actually have good circulation, not just for the heart, but just the blood vessels that it's pumping to. It needs to be conditioned, and if it's lazy, it'll get lazy too.
We're a car, basically. The more we drive the car, the better off it moves. If we sit sedentary into a parking lot, it's just not going to do anything.
Yeah, it's going to rust, so to speak.
Doctor, signs and symptoms of an anxiety attack.
Sure. So those overlap quite a bit with heart disease, and not uncommonly people come to the emergency department complaining of chest pain, palpitations, heart racing, and feeling really terrible. And those can, like I said, overlap with a heart attack as well. And so it takes an experienced physician like an emergency doctor or a cardiologist to help sort that out.
So those are the same signs and symptoms of a heart attack?
Yeah, unfortunately.
Is there anything else? Because a heart attack, isn't it one side the man and one side the woman?
So I think it's probably better to talk about heart attack in a specific sense.
Okay, then talk to us real quickly about signs and symptoms of a heart attack.
So the most common thing that you want to talk about from a heart disease standpoint is actually beyond electricity.
Okay.
It's actually the plumbing.
Okay.
The heart is a pump organ, and it needs its own arteries to stay alive.
Okay.
And if those lifeline arteries start blocking down because of too much cholesterol in our diet, starts clogging up the arteries, that could lead to a blockage of artery.
Okay.
And that's when the heart is starved for blood, and it's asking and it's crying out with pain.
Help me.
With chest pain,
Okay.
most commonly. And it's not usually pain, most people describe it as pressure.
Okay.
Like an elephant on their chest.
Okay.
And so that can be a first sign of a serious heart attack.
Okay.
Because the heart's crying out with pain.
Same for men and women.
Generally more commonly seen in men.
Okay.
And it's actually one of our harder subsets is actually dealing with women's presentations because they tend to be a little bit not so typical. And so an experienced physician has to sort that out as well.
Bottom line, if you feel like an elephant is sitting on your chest, call 911.
Yeah, that's a bad sign.
Your final thought in regards to heart health and palpitations?
Yeah, I think overall, palpitations can be within the realm of normalcy.
Okay.
And not to worry about every single sensation of a heartbeat. That's not okay. That's going to lead to unhealthy behaviors. But if it is beyond the normal, there's no circumstances to really explain it, and the heart's pounding, racing, feeling dizzy, any of those things, that needs a doctor, and potentially a cardiac electrophysiologist like myself can help guide that therapy as well.
Which can help bring the giggle back to your heart. Dr. Huang, thank you so much. And thank you for joining us. You can find us on social media, on Facebook at Glendale, on Twitter at Adventist Health, on LinkedIn at Adventist Health. And you can also find us on our website, adventisthealthglendale.org. Remember, the most important conversation you're going to have is about you and your health. And you heard it from the doctor, quit smoking. You heard it from me, get off your iPad, turn off the TV. As a family, get up, get out, and get your heartbeat back. We'll see you next time. Have a great week. Thanks.